and welcome to the official YouTube channel of Lema Dental Clinic in Istanbul, Turkey. Have you ever chipped a tooth and not wondered what your dentist will do to fix it? A chipped tooth can be unsettling, but don't worry, it's a common issue that can be addressed effectively. Today's video will walk you through the steps dentists take when you have a chipped tooth and the treatment options available to restore your smile. So what causes a chipped tooth? First, let's talk about what causes a chipped tooth. A tooth can be chipped for many reasons, including accidents or injuries, chewing hard food, or grinding your teeth. While a small chip might seem minor, it is important to get it checked by your dentist to further damage and ensure your tooth fit is healthy. Assessing your damage. When you visit the dentist for a chipped tooth, the first thing they'll assess is the extent of damage. Depending on how deep the chip is, your dentist may perform through examination, possibly an x-ray, to check the chip has effective tooth's inner structure or not. If the chip is superficial, treatment will likely be straightforward, but if it's deeper, further investigation will be required. Treatment options for a chipped tooth. Once your dentist hasn't assessed the damage, they'll recommend the appropriate treatment. There are the most common options. For example, dental bonding. For minor chips, dental bonding is a popular choice. Your dentist will apply a tooth color resin to chipped area, shaping it to restore the tooth's original form. The resin is hardened with a special tight and the bonding quick, effective, and it can be done in one visit. Veneers. If the chip is more noticeable or involves a larger portion of the tooth, a porcelain veneer might be recommended. Veneers are thin, custom-made shells that cover the front tooth, giving it a smooth, natural appearance. Dental crowns. For extensive damage, a crown may be needed. Crowns cover the entire tooth, providing strength and protection. They're especially useful if the chip has weakened the tooth structure or if it's significant decay. Root canal and crown. If the chip is deep enough to expose the pulp, the soft tissue inside the tooth, your dentist may need to perform a root canal to remove the infected tissue before placing a crown to restore the tooth. So the importance of timely treatment. It's essential to address chipped tooth as soon as possible. Even if the chip seems small, leaving an untreated chip can lead to further damage, like cracking or breaking, or cause sensitivity and pain. A timely visit to the dentist ensures your tooth is properly restored, preventing more serious issues down the line. Why choose Lema Dental Clinic for your chipped tooth treatment? At Lema Dental Clinic, we use advanced techniques and high-quality materials to restore your teeth to their natural beauty and function. Whether it's small chip or more extensive damage, our experienced team is here to provide you with effective and personalized care. We'll guide you through every step of the process, from diagnosis, treatment, to ensure the best results for your smile. So, if you've chipped a tooth on or have concerns about your dental health, don't wait to seek treatment. A quick visit to the dentist can make all the difference in keeping smile intact. If you found this video helpful, please like, subscribe, leave any questions, or comment down below. Thanks for watching, and we're looking forward to restore your smile here at Lema Dental Clinic.